So when someone suffers from both a mental health disorder and a substance use disorder, one could have two different disorders that don't really interact very much. But quite frequently what actually happens is the two disorders interact and make each disorder more difficult to manage. So the substance use disorder becomes more pronounced while people are trying to manage a bad depression. At least they feel a little better when they've been drinking alcohol for a little while. It lifts the depressive mood. So they can actually potentiate and make each other quite a bit worse. We don't experience these two different disorders separately. It's an integrated problem. It's one leads to the other, leads back to the one. For us, there's not a lot of separation. When the treatment system treats it as if the depression is separate from the alcohol use, you go one place to get your depression treatment, another place to get your alcohol treatment. In essence, we're asking people to sort of carve these two things apart. They don't exist apart. They exist in a single integrated whole. The distinction has been for many years that there are two separate divisions. One is the Department of Public Health and one is the Department of Mental Health. And so even at the structural level at the government, there are two distinct silos. And the result is that people who are primarily trained in mental health are not actually trained as well in the substance use disorder protocol, and vice versa. I also think there are a number of payer problems that need to get sorted out, and I would love to see that we got past our notions of stigma, judgment on these people. What they have is a disease, it's like any other. Unfortunately, it's a sort of an integrated piece between their genes and their experiences in life, and the result is this difficult disorder. And for all of us to understand that, be ready to treat it more effectively and to drop and get rid of the judgment and the punishment, which ultimately makes them sicker, makes healthcare costs higher, and doesn't move anything forward.